Hi everyone! Welcome back to my channel again. So today we're going to be talking about something very important. So this time, of course, it's not COVID related. It is related to something that has been an enduring question, which is, are my psych meds safe? Okay, so all of us are asking, if I take all the psychiatric medications, will they be safe? Okay, and that is a super valid question. I know a lot of people are scared to take their medications. So the first thing that you have to know though is your medication prescribed by a qualified doctor, a licensed practicing doctor? If so, I am sure that whatever medicine they have given you, they have studied, they have considered, and must have been safe for you, including the dose. Most of the time, well, actually, all the time, they will not give you anything that is going to overdose you. They have studied, rest assured that they have studied for years, so that hopefully they do know the medication that they are giving you. So I am sure if they have been licensed, if they're able to graduate at a reputable institution, I'm sure that I can assure you that they do know what they are doing. Okay. And then after that, we will talk about now the medication per se. Let's take, for example, an antidepressant. Is it safe? Yes. Most of the antidepressants and any antipsychotic medications are very safe as long as you take it according to how your doctor has prescribed it. So it is really important for you and your doctor to be able to work together and for you to understand how your doctor have given it to you. So I am not, it is very important to follow that to the dot. So if, for example, if she has told you to take it once a day, then take it once a day. If she tells you to take it twice a day, then it's good to take it twice a day. Because she knows and she has studied, or he or she knows when or how often the medication should be given, how long it will be in your system. So therefore, that is the reason why people would sometimes give it to you for 2 times a day or 3 times a day or whatever. However, it was told to you, it is important for you to take it that way. And then, of course, are there any side effects? Yes, we will not lie. All medications have a possibility of having side effects. And again, if you work closely with your doctor will tell you what to watch out for. That is expected with that type of medication. They will tell you, for example, what kind of medication or what kind of side effect is bearable or is expected and normal for this medication and that you should endure. And she would also tell you what type of reaction should you then find very alarming. Okay, so let's take, for example, for antidepressants. Some antidepressants might, that's why the term, the key word there is might, because it doesn't always happen to everybody. Just because, for example, Jane got it, it does not mean that Faye will get it. Do you get it? So your reaction, one person's reaction, does not always mean that you will have it, but it is possible. So for example, an antidepressant, you might have palpitations, you might have headaches, you might have restlessness, you might even have some slight blurring of vision, you might have nausea, but this should be transient, this should be bearable, and if not, you have to let your doctor know. But if it is there and it is bearable, I do suggest that you continue your medication. It will pass. So most of the medications are supposed to if they do have side effects, they are supposed to go away after a couple of days or a couple of weeks. You see, unfortunately, with some people, the side effects comes first. So some people, they get scared to take it again. So I want to reassure you, yes, they might have some side effects, but please do not give up on your medication. Do not give up too early. If it is bearable, please bear with it, and eventually you will start feeling better. And then you're gonna ask me, Doctora, well, what if, I have it and it's, I'm really having a hard time? Well, sometimes, if it's really difficult, tell your doctor. If it's not, then I say try to tide it over. Why? Because I'm gonna tell you, it's worth it. It's worth it to somehow just bear with it for like a couple of weeks, rather than bearing for the rest of your life, having all that palpitation, having all that fear, having all that symptoms that is debilitating. I always tell my patient, isn't it better to like have a bearable headache for about a week than to have that for the rest of your life, or have a little bit of restlessness for a couple of weeks, rather than having it for the rest of your life and not being able to work. So sometimes you make these choices, and sometimes we have to sacrifice, but again, the key word is bearable. If it's bearable, you stick with the medication. If not, your doctor can give you another type of medication, and some other medications might be more suitable for you than others. So don't give up. Okay? And then you're gonna ask, am I gonna be dependent on this? Okay, the answer is no, it's not addicting. But will you need it? Probably for maintenance. It's possible. So why is that possible? There's a difference between being addicted to it, between having or needing it. So remember, I would like to take diabetes, which is very known to everybody, as an example. With diabetes, you lack insulin, right? So therefore, not because you're addicted to it, you have to keep on having some type of medication or having an insulin injection. Not because you're addicted, you don't go crazy wanting it, or you don't go crazy stealing people's money, or trying to get the insulin, but you do need it to survive. Therefore, it has to be administered. So it's the same way with depression, or with psychosis, or with anxiety. You do need, or are at that moment, you do need the neurotransmitter, depending on the respective neurotransmitter that your condition needs. Like for example, for depression, you need your serotonins. For psychosis, of course, you need dopamine. Of course, it's more complicated than that. But what I mean is, there are some neurotransmitters that you need that can be helped by taking the medication. So you're not addicted to it, but the supply of it can be improved or increased by taking this certain type of medication. So therefore, are you addicted? No. Are you dependent? It depends on how you want to define dependence. You need it, yes, so therefore it has to be supplied. Just like, as I've said, insulin, or just like when you have an iron deficiency, then we have to supply that externally. That's why you have to take the medication. Now, addiction again, per se, depends on your the definition. The layman's definition of it is that you're looking for it, you can't stop, and you basically cannot live without it, and you become irrational, violent, and all of that because you want it. No, our medication does not become like that, at least not the family of the SSRIs, or antidepressants like sertraline, escitalopram, antipsychotics like olanzapine, risperidone. Those are not addicting. However, there are anxiolytics that might be addicting, and these are what we call the clonazepam, or that Rivotril, or alprazolam, which is called Sanor. So those two might be, or have the possibility of being addicting. But again, under the supervision of your doctor, it can be safely taken. It really does You really have to follow your doctor's directions, and you should not use it as an excess. So usually, we give another type of medication for your prolonged use to actually hopefully help relieve the problems. Okay, and then if I have to ask you again, or we would talk about it again, Doctora, is it gonna affect my liver? Is it gonna affect my kidney? The answer should be no. As long as you do not abuse it, it should not have an adverse effect in your kidney or your liver. Again, as long as you are taking it with the right directions. Okay? And provided you are not abusing your body, you're not taking drugs, you're not abusing alcohol or any of that stuff, all these medications have gone through researches and have been proven safe. Okay, and just in case your medication does have a side effect, your doctor will inform you. Whatever that may be, your doctor will inform you if you have to watch out for it. But I do have to urge you, my beloved, I know you want to preserve your liver. I know you want to preserve your kidney. But please remember, which one needs to be preserved so much more? Is it your brain? Is it your child's brain? Or is it your child's liver? You see, if their spirit is broken, if their brain is not functioning well, the entire person will not be functioning well and will not be able to function the way we want them to, and might not be able to contribute to the society. Now, if we somehow have a liver problem, we all know and we've known other people who are sick, but somehow if they have their psyche intact, they are mentally well, you know that they are able to survive and they are able to somehow lengthen their lives also. So which one is safer? Is it a good liver or is it a good brain? I really urge you, I pray that you choose a good brain for you or for yourself or for your children. I do promise you that if it is given by the credible doctor, it is given by and it is a true medication from that FDA or all of our boards have approved, then it should be safe for human consumption. You know, everything has listed side effects on Google. I would challenge you, you can even look for your vitamins, and if they have any side effects, you will also see a zillion of it. So please take your medication as prescribed by your doctor. There are side effects, we're not gonna lie about that. There will be problems for those who are allergic to it, and at the most there might be what we call the neuroleptic malignant syndrome or the serotonin syndrome, but this is only in high doses or for those that are predisposed to it, and it is rare. Nevertheless, your doctor will also know and will tell you what to watch out for and would know how to control it as long as you work hand in hand with them. So all medications are safe as long as it is taken as directed. So I urge you, my beloved, please keep on taking your medication. I pray that you would choose to take your medication and to protect your mind and your brain and your mental wellness, rather than believing in all the unnecessary or unfounded claims on the internet with regards to your medication. Trust that your doctor will not give it to you if you do not need it. If you can survive with just talk therapy, she will refer you to a psychologist if she cannot do it herself. But I am sure that She will weigh all the things that she can or needs to weigh before giving any medications. All right, so I hope I am able to help you, and I hope I am able to clear things out with regards to the medication. So you take care and keep safe. I do hope that you are trying to shift your mind and trying to see the blessings of being here with your family. If not, it's okay. Do give yourself a pat on the back by trying to survive, and if it's really getting hard for you, do not hesitate to ask for help. All right, you take care, and you're important to us, at least to me. So for all my patients, hello. I'm sorry if I'm not all being able to if I'm not able to answer your questions one by one, and hence actually that's why I'm actually trying to create all of this video so that you can refer to them for any questions or anything that you need. I know one of the questions or fears is with regards to medications. All right, so you take care. Bye bye.